Cardiac tamponade or tamponade. So let's say that you're a nurse in ER, and let's say that someone was rushed to the ER, which had an accident with vital signs including tachycardia, hypotension, and low oxygen saturation, with cold and clammy skin. So what could it be? So what should we do? What what is the first thing we want to do as a nurse? So today we're going to talk about cardiac tamponade or tamponade. So compression on the heart so the heart can pump out oxygen to the body. So first, let us define what is cardiac tamponade. So cardiac tamponade is a serious medical condition in which blood or fluids fill the space between the sock that encases the heart and the muscle. So cardiac tamponade also comes from the root word tampon, and since tampons refers with blood. So the sac around the heart fills up with either blood or fluid like a big water balloon, putting pressure on those ventricles, which eventually stops the heart. And no heartbeat means dead patient, and everyone knows this. But why though? Well, this is because the heart pumps out oxygen-rich blood out to the body, called cardiac output, and this compression on the heart causes a dramatic drop on cardiac output, meaning drop in blood to the body, or in other words, low cardiac output means low oxygen put out to the body. So let's see. So this is the comparison between a healthy heart and one with cardiac tamponade. So as you can see, the pericardium of this heart is filled up with fluid or blood, which compresses the chambers inside the heart. So, so what's really going on in the body? So this is the pathophysiology. So this pathophysiology, what I'm going to do is that I'll try to illustrate it in a very simple diagram. So let's first go to paint. So I'll draw. I'll draw first. But we all know that the heart doesn't look like this, but it's okay. For diagram purposes only, it's good to draw in a way that people can easily understand. So first, let's label this as left ventricle, the left atrium, the right atrium, the right ventricle, and these are the veins that bring blood back to the heart, inferior vena cava and superior vena cava. And then blood comes out through the aorta. So outside the heart is a layer. Outside the heart is a layer called the pericardium. This is the pericardium. So normally, the pericardium have some fluid in it. So what happens in cardiac tamponade is that there is an accumulation of blood or fluid inside this pericardial space. And what happens eventually, this fluid or blood can expand and then can start to compress in the ventricle inside, like in the ventricles in the heart, like this. So as the fluid accumulated inside the myocardial space, it compresses the ventricles and squishes and or compresses the heart. So basically, they make the ventricle volume smaller. So you can see that the chamber are getting smaller because of the fluid buildup. And that is very, very worrisome because it can cause three major things that can be detected when a patient comes in. And these three things are collectively known as the Beck's triad. Beck's triad. A Beck's triad. So the Beck's triad. So these three things. The first thing is called hypotension. To fully understand this, I'm going to explain each one of them later. The second one is that the heart sound is muffled or distinct. Muffled. And the third one is the jugular venous distension. Venous distension. What it means is that the veins, then the neck veins will be distended. So now I'll explain to you each one of them. So the first one, hypotension. So why does this happen? So let's say you've got a severe tamponade that is just completely expressed in the drawing. So look at how much smaller the left ventricle has become. Now because of this, the heart can't properly expand to fill this left ventricle. Normally, the left ventricle fills with blood. Then the blood is pumped out to the aorta. But in cardiac tamponade, you actually have a left ventricle that is getting smaller and smaller. So let's look at this diagram. The left ventricle has gotten smaller due to the fluid or blood buildup in the pericardium that reduces the so-called stroke volume. It reduces the stroke volume. Now the stroke volume is directly tied up to cardiac output. In fact, the equation cardiac output is equals to stroke volume times heart rate. So the stroke volume go when so a stroke volume goes down, so does the cardiac output. So when the cardiac output goes down, less blood is basically being pumped into the aorta. Less blood is pumped out also into the circulation. That means the pressure of the blood in the circulation is lower, and that's why you get low blood pressure or hypotension. So the next one is that the heart sound muffled. So the heart sound muffled or distinct. So why does this happen? Well, the reason is because that the fluid here around the heart are excess blood that surrounds the heart. So it makes more difficult for us to hear the heart sounds. We normally uses stethoscope to hear it in a patient's chest. So the last one is the jugular venous distension. So the last one. So why does this happen also? Because this happens because all the blood or the fluid that built up in the pericardium is essentially making the atrium, the right atrium specifically, and the right ventricle. So what happens? It causes the blood to go back into the veins, and when that happens, the veins get distended. So that's what happens. So that is the theory of the Beck's triad. Let's go back to the PowerPoint. So what are the signs and symptoms? So naturally, all the signs and symptoms from this low cardiac output, this low oxygen to the body, will basically see classic complaints from this low oxygen and low blood pressure. Now, the very first sign we'll see for low oxygen is always restlessness, which is the easiest indication for hypoxemia, just a fancy word for low oxygen in the blood. This restlessness is also seen as altered level of consciousness, or they even call it the change in mental status. So we also see dizziness, passing out, called syncope, and fatigue, shortness of breath, and we'll also see tachycardia, which is the very first sign of decreased cardiac output. Now, why did I say that? Why is tachycardia the first sign of low cardiac output? Well, as the body starves for oxygen, the heart tries to compensate by pumping faster and faster, so that faster and faster to 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 deliver the limited blood supply and oxygen around the body. Now, a cardiac tamponade, as the heart gets squashed, a condition called Beck's triad occurs, which I have discussed earlier. So to easily remember what is this Beck's triad, I have made three easy to remember acronym. Beck's triad. And it is this BEC. Big B for big jugular vein or jugular venous distension, and E for extremely low blood pressure, and C is that you can't hear any muffled sound or the heart sound because they are muffled by all the fluid around the heart. So this is the example of this is a picture of a patient that has jugular vein distension. So next, for the causes. And for the causes for cardiac tamponade, it is all about these two Ds, the damage and the disease. As we all know that as we know, damage from trauma is the most common cause. So penetrating trauma like stabbings, gunshot wounds, blunt force trauma like car accident or falls are the most common causes. And second, D is for disease, which are less common causes. Cancers, connective tissue disorder, autoimmune disease like lupus, in which the body attacks itself, and also renal failure. And lastly, hypothyroidism, which are very rare. So, and for the diagnostic test for cardiac tamponade, and again to recall, the big photo here is that the heart is getting compressed and squished under the water balloon heart sac or pericardium. So we can do chest X-ray, which show a slight widening. So you can see in the diagram a slight widening and enlarging of the heart sac, kinda like a water balloon shape. And we can also do echocardiogram, an ultrasound called echocardiogram. This may reveal moderate to large effusion. As you can see in the diagram that the heart moves like it moves like swinging. The heart sac is swinging like like a tire swing. So next is that as for cardiac monitoring, we also talk that there's gonna be uneven and low voltage complexes in the precardial leads, specifically in our QRS complex, which will show short and tall peaks in our QRS complex. Since those ventricles are being squished, we'll also see a rapid heart rate called the sinus tachycardia. And lastly, hemodynamic. Hemodynamic is only measured after a big tube is placed inside the heart. Inside the heart. This is like a spaghetti noodle. Heart is a spaghetti noodle big tube. And this is called the Swan's catheter. And it is used to measure the heart pressure for critically ill patients. So, now that we know what is wrong with the patient, we are going to talk about we are going to do what are we going to do about it. Well, first we should ask ourselves to what is the main patient outcome goal. So to make so we want the body to pump out more oxygen to the we want out that the heart pump more oxygen to the body like normal, right? So we we need to increase the cardiac output so that the oxygen to the body can make perfusion. So what can we do about it? Well, we gotta drain that heart sac, and this is called the pericardiosynthesis. So pericardiosynthesis, what is this? What is this? So pericardiosynthesis is the aspiration of fluid from the pericardial space that surrounds the heart. This procedure can be life-saving in patients with cardiac tamponade. So this is the process of the pericardiosynthesis. So it is when the doctor sticks a big fat needle into the pericardium heart sac to drain or aspirate all the fluid. So as for our nursing consideration, we need to do these things. First is that we need to monitor the patient on the cardiac monitor. Number two is to monitor the patient catheter to be left in place while ensuring it's attached to a closed drainage system with a three-way strap. And lastly, number three, periodically monitor the drainage device for kinks and slow drainage. Now, rarely if needed, we can give inotropic drug like digoxin, which gives a forceful and non-deep contraction. So, to easily remember this inotropic drug, D is for digoxin, and D for deeper contraction. So this deeper contraction increases cardiac output, basically meaning it's increasing oxygen to the body. So nursing diagnosis. So what is our nursing diagnosis? So nursing diagnosis: decreased cardiac output related to alterations in heart rate and rhythm as manifested by cold and clammy skin. As the sac gets squished by the filling up of the fluid, it leads to less or decrease of cardiac output. Hence, less blood being pumped out of the body and less oxygen to the body. So our nursing intervention, first that is that it is important to periodically monitor the patient's heart rate and blood pressure. As most patients have compensatory tachycardia and significantly low blood pressure in response to reduced cardiac output. Also second, we need to monitor the ECG for rate and rhythm. As cardiac dysarrhythmias may occur from low perfusion, acidosis, and hypoxia. And lastly, we also need to monitor the oxygen saturation with the use of pulse oximetry, because with decreased cardiac output means less oxygen in the body, and hypoxia is common and can be deadly. So in summary, for cardiac tamponade, think the letter C for cardiac compression or the heart. So the heart can pump out blood, usually caused by big trauma like accidents, stabbings, heart attacks, gunshots, and even from fall. Whatever the cause may be, the heart sac around the heart fills up with blood or fluid and this compresses the ventricles, so they can pump out oxygen-rich blood to the body, meaning less cardiac output, less blood pump out to the body, and less oxygen to the body, and less oxygen means the patient will die very, very soon. So we need an immediate intervention called the pericardiocentesis, where we stick a needle in the heart and drain the fluid.